Okay.
where it was being first discovered that there's something called salmonella typhoid fever.
Okay.
And it's in the history that a country called Atan, Athan, was Atan was affected widely. About 1/3 of the population died out of the disease. So it was later, as in the 19th century, when they discovered that there's something like that called the salmonella type. Then year on, they built a vaccine to help prevent the spread of the disease. Specifically, it was meant for the military personnel, those who travel to remote cities to fight the infection. It was not for them to at least protect them when they are going to such areas. The disease is mainly, or it's widely seen at places where sanitation is a problem in our part of the world. And this discussion is very important. Especially in the season that we are in.
Thank you.
Rainy season.
Thank you.
It's very important for us to discuss something like that because it's on the rampant. When you go to my facility, for instance, out of those who come with gastrointestinal conditions, about 2/3 of them are being diagnosed of typhoid fever. So it's very important for us.
Just when the rains began.
Yes. So the history, as I said earlier on, these people didn't know much about it. They were with it, but they didn't know until the 19th century when they diagnosed it. And the World Health Organization postulated that about 61,000 people are being diagnosed of typhoid fever, and about 200,000 people died out of it. So it's a serious condition that I think we should talk about.
Yeah, the numbers are huge. Yeah. So very good. Let's go into the specifics. So at your facility, how is it happening?
Yes, so
the cases come in.
Yes, when they come, they will present with a symptom similar to malaria, similar to gastrointestinal conditions like gastroenteritis, gastritis. If someone can present a symptom like someone who is having a HIV, they are just like normal conditions around. But until further diagnoses are put out there for us to distinguish what it is from the other conditions, we cannot specifically say that this is typhoid fever, but you need to be diagnosed. That's why it is important for you to quickly go to the health facilities for intervention. So they come, they will be vomiting, some will be having diarrhea or constipation depending on the individual, high fever and all that.
All right.
So they really come.
So when we do the history, the people would have really come into contact with that exposure. Let's say the feces on food or a housefly. You get that history from them.
Yes, since as I said earlier on, it's mainly a condition of less sanitary problem or less sanitation problem. The immediate thing that the person will present will be the similar condition that people bring with, but this time you need to take a sample of the individual. It can be either feces, blood, or bone marrow. But because bone marrow is a very dangerous process, we mostly go with the feces and the blood. When such person come and we take such sample, we take it to the lab for the lab personnel to investigate or to know. But once diagnoses are being confirmed, it means you've eaten something.
All right. I think with the courses, if I learned well, you said the Salmonella typhi and then the Salmonella paratyphi. The paratyphi is causing the mild form, and the typhi is what's causing maybe, let's say, the dangerous forms. Okay. Can we talk about risk factors? Are there risk factors of the typhoid fever?
Yes, there are a lot of risk factors.
Okay.
The first one I'll talk about is the less developed countries. Those who are living in the less developed countries are at higher risk.
The fact that you stay in a less developed country.
I'll say something about that one.
Okay.
Even if you come to Ghana, we are underdeveloped though. But when you go to specific areas in Ghana, it's hardly for you to get typhoid fever like the East Levant, where the sanitation problem is highly at.
Yeah, my area too.
Your area.
My area too.
Places, though you are in a less developed country, but because of well sanitation going on at your area, you are at lower risk. So as I said earlier on, the higher risk is at those who are living in less developed countries where sanitation is a problem. Children too are mostly affected because of their immune system. they don't have stronger immune system as the adults, and also because children tend to play a lot, they take inanimate objects wherever they take it. They don't mind, they inject it and all that. So they are also at a higher risk. And those who travel a lot, especially the whites that travel down to the western part of the world, where they come to visit, tourism and all that. The military people, as I said earlier on, they go to places where they don't even know. Those who travel from their states to the different countries to settle disputes and all that, because the sanitation over there is not at the top notch. When they get in contact with the infected feces, they are going to get there. So to rank it, less developed country, children, travelers, military personnel, they are at high risk.
Okay. All right. Let me just ask this. With COVID, we heard the elderly, those with underlying diseases, and pregnant women. Do such people fall into this category as risk factors for this?
Yes, exactly. Since the elderly have less immune system, their immune system is not as strong as those in the middle age. Yes.
All right. And I guess pregnant women too, because their immune system will be lowered at that time. Okay, all right. Now let's go into the science. This one take us to class. So if someone has this contact exposure, the bacteria gets into the person, the pathophysiology, the pathogenesis. I think you started earlier, but yes, what happens?
Yes, so now let's take it as someone has eaten someone's infected feces. The contaminated food or water that a person drank or ate enters into the stomach, and specifically the GIT. The organism that the Salmonella typhi affects the pious patches that I talked about. It erodes the layers of the small intestine. Now the bacteria travels through the bloodstream, and in the bloodstream they are being carried by the white blood cell, either from the liver, the spleen, or the bone marrow. So when they carry them, they remultiply. They really multiply fast, and they re-enter into the bloodstream.
I see.
They affect some organs like the gallbladder. They affect some organs like the lymphoid tissues of the bowel. That's how come we take blood, bone marrow, and feces for diagnosis, because these are the areas where these organisms are being traveling to. So now they've moved from the bloodstream. They've attacked some of the organs like the gallbladder and the lymphoid tissues of the bowel. Now they pass through the gastrointestinal, the GIT. That's where they trade along. So they trade along these lines, and in a longer stage or at a higher stage, they erode these surfaces too. So when the condition is not treated or diagnosed early for it to be treated, it can cause a serious complication where the intestine can empty its contents into the abdomen. And when it happens like that, it's a medical emergency. That's at the higher stage. The incubation period is about 3 days to 3 weeks. At this stage, an individual can either present signs and symptoms or not, depending on the individual immune system. So within 3 days to 3 weeks, a person can show signs and symptoms. That's the incubation period.
Wow.
The organism can stay there, do whatever you want to do. As it's multiplying, then it manifests itself as the typhoid fever. So this is the brief pathophysiology from the mouth down to the GIT, passes through the bloodstream, then it affects other parts of the body. One significant thing is that if care is not taken, it can travel to other parts of the body. The lungs, the heart.
Yeah, I was going to ask that because on the street or somebody said the kidneys, the liver.
Because the body is connected together. It affects one part, and care is not taken. It can travel to all parts of the body.
Wow, that's a serious infection.
Very serious. At the latter stage, it's normal, but when you are not being taken care of it,
and then the erosion begins. Does it begin from the esophagus or it begins from the small? Okay.
So specifically in the small intestine where it actually begins.
All right, and then it could erode the intestine to empty.
The intestine can be eroded when it gets to the higher stage.
ulcer comes into my mind.
Yes, so it's creating inflammation over there.
Yeah.
Holes are being created in the intestine. Ulcer can settle in.
Wow.
Yeah.
Right. Okay, so I think this would move us straight into the signs and symptoms. So if this is happening, how will someone for himself or herself say that, Charlie, I think I'm getting typhoid fever?
Okay, as I said earlier on, it mimics other conditions. The signs and symptoms mimics other conditions. So one cannot say that I'm having typhoid fever unless you are being diagnosed. So you present symptoms like fever, headache, abdominal pain, or stomach pain, the layman's language. Then you feel very hot. Your temperature runs very high.
Okay.
It can run as higher as 40 degrees Celsius. Yes, it's very serious. And also your abdomen will pain you. If it gets to the latter stage where the intestine empties its contents into the abdomen, your abdomen will be distended. Yes, so these are some of the signs. When upon all the symptoms that I mentioned, it's similar to other conditions like malaria. That's why it's very important. When you go to the health facility, you wholly say what's wrong with you. Some people will come and they will not be open to say what's actually wrong with them for you to be able to diagnose them well.
When the person has come to the health facility, the person won't talk.
No, he won't talk. Recently, I think last week someone came to my facility. What will you do? The person will be lying there, just looking at you.
But the person has come.
The person has come. So until you probe further to know what's actually wrong with the person, even talking is difficult for them. You cannot always blame them. At times, the condition put them in a state where they cannot even talk. But when you go there and you talk wholly, it helps the practitioners to also know what's actually wrong with you, so that they can diagnose you.
Let's take the symptoms one so that the investing committee can learn it very well. So I think you spoke about the fever.
As your temperature runs very high. Headache is there.
Headaches are there.
Yeah. General body weakness, or the health people, general malaise. You say that. Yes, your abdomen will be distended. Abdominal pains. Sweats. You can sweat very profusely. Yeah.
Okay. So people, we are looking at. Okay.
You can either have diarrhea